Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Everyday activities that cause noise-induced hearing loss. Noise-induced hearing loss, NIHL, is a common type of hearing loss that occurs when you are exposed to loud noises over a prolonged period of time. The exposure to sounds over certain decibel levels can damage the delicate hair cells inside the cochlea, which are necessary to hearing function. Once these cells are damaged, they are not capable of repairing. /r/n/r/n This article discusses the causes, symptoms, and prevention of noise-induced hearing loss. /r/n/r/n Xavier Lorenzo, Getty Images /r/n/r/n Loud noises can damage many of the delicate structures necessary for hearing. /r/n/r/n For example, a very loud noise may rupture the eardrum or damage the tiny bones inside of the ear. Loud noises can also damage the hair cells inside of the cochlea. Fortunately, these are rare, and usually require extremely loud noises, often associated with a blast type of event. /r/n/r/n If the eardrum or bones inside of the ear are damaged, the associated hearing loss may be temporary and treated. But if the hair cells inside of the cochlea are damaged, any subsequent hearing loss is permanent, since these specialized cells are incapable of regeneration. /r/n/r/n Noise-induced hearing loss can occur in individuals of all ages. It frequently affects individuals who have occupations where they are exposed to a lot of noise. This can include /r/n/r/n affects 12.5% of children between the ages of 6 and 19, and 17% of adults between the ages of 20 and 69. /r/n/r/n Decibels are units of measurement used to measure the intensity of sound waves. /r/n/r/n On the decibel scale, silence, no sound, would measure close to 0 decibels, decibel. The higher up the decibel scale at which a sound is measured, the more intense the sound wave is, or louder the noise. The decibel scale is a logarithmic scale, so small changes in decibel levels can represent a large change in the level of sound. /r/n/r/n Sounds over certain decibel levels are more likely to cause NIL. /r/n/r/n Symptoms of NIL may come on gradually or suddenly, depending on the type of noise exposure. /r/n/r/n If you are exposed to slightly higher than healthy noise levels over a prolonged period of time, you might not even notice a gradual loss of hearing. If, however, you are exposed to something like an explosion, the hearing loss and other symptoms will come on quite suddenly. /r/n/r/n Symptoms of NIL include, /r/n/r/n If you have a ruptured eardrum, you may have some bleeding and pain from the ear initially, and may experience some dizziness. If you suspect you have a ruptured eardrum, be sure to keep your ear dry and see your healthcare provider, as there are precautions you should take to prevent further damage. /r/n/r/n Some NIL may be temporary, but once the delicate hair cells inside the cochlea are damaged, any associated hearing loss is permanent. /r/n/r/n If you are exposed to a very loud noise, such as an explosion or gunshot, you may experience both temporary and permanent hearing loss if it leads to a ruptured eardrum. You will initially have quite a bit of hearing loss, but the eardrum is capable of healing. However, if the tiny bones in your ear are damaged, they may or may not be able to be repaired. /r/n/r/n Even once these structures have healed, however, it is likely that you will have at least some damage to the hair cells in your cochlea, which are incapable of regeneration. /r/n/r/n The decibel scale for noise-induced hearing loss is as follows. /r/n/r/n About 22 million workers in the United States are exposed to noise levels capable of causing NIL each year. There is a real risk in occupations that use equipment over 85 decibels, as workers may not understand that certain tools are loud enough to damage their hearing. Things like auto mufflers, power drills, and electric screwdrivers can fall into this range. /r/n/r/n It's important to know what you are being exposed to and to take steps to prevent NIL when possible. /r/n/r/n Many forms of entertainment involve noise levels that can lead to NIL. These include /r/n/r/n It's important to turn the volume down, wear earplugs at loud events, and to limit the amount of time you spend participating in these types of activities. /r/n/r/n Some tips to prevent NIL include /r/n/r/n Some personal music players are designed with volume levels that will not go above an unsafe level. If your child listens to a personal music device that does not have these safeguards, make sure you talk to them about the dangers of listening to music too loudly and monitor appropriately. /r/n/r/n When you are unable to prevent your child from exposure to sounds over 90 decibels, you can provide them with earmuffs or earplugs to protect their hearing. /r/n/r/n The most common treatment for NIL is hearing aids. /r/n/r/n Hearing aids are devices that can be worn behind the ear or just inside the ear canal, which amplify sounds so they can be better heard. /r/n/r/n In severe cases, hearing aids may not be effective for NIL and a cochlear implant may be a better option. A cochlear implant is a surgically placed device with multiple parts, including a /r/n/r/n Unlike a hearing aid, a cochlear implant bypasses damaged parts of the ear and directly stimulates the auditory nerve. /r/n/r/n Working with a speech-language pathologist or similar healthcare professional can help to improve your communication and social skills and better navigate life. /r/n/r/n Noise-induced hearing loss is extremely common and can affect people of all ages. It is caused by exposure to loud noises, such as explosions, gunshots, construction equipment, and loud music. /r/n/r/n NIL can be prevented by limiting the amount of time you are exposed to loud noises. Some NIL is permanent but can be treated with hearing aids or cochlear implants. Working with a speech-language pathologist may help to minimize the symptoms of NIL. /r/n/r/n Preventing noise-induced hearing loss from occurring is crucial, since it is common and often permanent. Untreated NIL has even been linked to social isolation and depression in some people. However, working with your healthcare provider can offer adequate treatments to improve your quality of life and your ability to communicate with others. /r/n/r/n Some NIL is reversible, such as that caused by a ruptured eardrum. However, once the delicate hair cells inside the cochlea become damaged, they cannot be replaced and subsequent hearing loss is irreversible. /r/n/r/n Using noise-cancelling headphones to listen to music at appropriate decibel levels or during everyday activities is not harmful to your hearing. However, using noise-cancelling headphones in place of sound-blocking devices, which are more effective, can result in NIL. For example, if you are exposed to loud noises at work, it is not appropriate to wear noise-cancelling headphones in lieu of approved hearing protection devices, such as earplugs. Listening to noise-cancelling headphones at volume levels greater than about 85 decibels can be harmful to your hearing. /r/n/r/n Sounds over 120 decibels can cause immediate pain and injury to your ears. Examples of sounds over this level include firecrackers, sirens within close range, gunshots, or explosions. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.